Hi, welcome to Talking with Docs. I'm Dr. Paul Zalzal.
And I'm Dr. Brad Weaning.
And today's episode is concerned with what to do before your total knee replacement. So you've met with your surgeon, you've booked a total knee replacement. We're going to discuss what you have to do to prepare for that.
I think that's a great thing. A lot of people that come to the office, the consult happens quickly and they leave in a bit of a tizzy.
Yeah.
So we're going to try to give you some stepwise steps to help be more prepared.
Right. You can, and this is very similar to our video on how to prepare for a total hip replacement, but there are some key differences. First thing I'm going to say is it's okay to be nervous. Everybody is nervous before surgery, and usually they get more and more nervous as the day approaches. That is normal.
Yeah, and by preparing, hopefully we can just reduce some of your anxiety and increase your chance of success.
Right. Okay, so I've got my package here. I've booked my surgery, and generally in your surgeon's office, you're going to get a package that'll instruct you how to arrange a pre-operative visit at the hospital where you're having the surgery done, where you're going to get a ton of information.
So typically there, I know at our hospital, Paul, we have a class where they teach you a bunch of things, what to expect. There's some patients actually that have had knee replacements done to help explain it to you. And then you have some blood work, a chest x-ray, usually potentially a cardiogram, and then you may or may not see the anesthetist to talk about the type of anesthesia that you would get.
Right, and you'll have to see your family doctor before to have sort of a health assessment to make sure that you're as healthy as you can be for the surgery.
And usually either your family doctor or the hospital will tell you when to stop eating and drinking, when to stop your pills. Typically, what do you find they tell you, Paul?
No eating or drinking after midnight the night before surgery. And then the pills, it depends on what pills you're on, what medications you're taking, and for what reason. And those are generally addressed when you go to your pre-op visit. The ones that sort of have the most concern are blood thinners, so that you will come up with a plan on when to stop your blood thinner, and if you need an alternate blood thinner from the time you stop it until the time you have your surgery.
A lot of people tell me, hey, my surgery's in the afternoon, why do I have to go so long without eating and drinking? Like, what's the big deal? I'll just have a small breakfast, maybe, have a donut.
Right. Well, you've got to have an empty stomach for surgery, and then the anesthetist is really the one who really wants you to have an empty stomach, because if you have a full stomach, you may vomit during the surgery when one of the anesthetics are being administered, and which isn't a huge deal if you vomit, but if you aspirate it or breathe back in some of that, you could end up with a very dangerous pneumonia or lung infection. So it's important to have an empty stomach before you have an anesthetic.
Okay, so we're through the medical side of before the knee replacement. What comes next?
Well, preparing yourself and, well, it's kind of medical. It's modifying your risk factors. Risk factors are things that put you at an increased risk for a bad outcome. And some risk factors are modifiable. So if you can modify a risk factor before surgery, then do so to increase your chance of outcome. So if you're a smoker, you've got to try and quit smoking. If you have obesity, you're carrying extra weight, try weight loss. This will help you get a better outcome.
Another thing that I tell people is manage your medical problems appropriately. So if you have really high blood pressure, talk with your family doctor, get that under control. If you're diabetic, you don't want to be too sweet for surgery.
Yeah.
Like you, Paul. And then the other modifiable, yeah, you're very sweet. The other modifiable risk factor would be the range of motion and strength of your knee. So the stronger you can be and the better your range of motion before a knee replacement, there's good evidence to show that's going to improve your function. So attending an organized physiotherapy program, either at a hospital or at a private clinic, and working on the exercises on your own at home has significant benefits for you as a patient. And as we cut through the muscles to do the knee replacement, if they're stronger before and you know the exercises, it's going to make things easier afterwards.
Right. The biggest risk factor for a stiff knee after total knee replacement is a stiff knee before total knee replacement. So get your range of motion as good as you can before you have your knee replaced. So we've talked about the package you're going to get from your doctor that's going to hook you up with a pre-operative visit to the hospital. We've talked about seeing your family doctor. We've talked about modifying any risk factors you can modify, medications that might have to be stopped before, doing some prehab before. What else?
One of my big things is I want people to have a plan for when they're leaving the hospital. So a lot of people say, well, I just want to stay in the hospital till I'm better. Unfortunately, particularly in Canada, as we have a socialized healthcare system, that is not practical. You're going to go home on day 2 or day 3. On a rare occasion, you might get some inpatient physiotherapy, but I need people to know that where are they going to go? So the options being, you might be able to go home, you might go home to live with one of your children,
Right.
you might potentially go to a convalescent care home, but you need to have a plan.
Yeah. You're not going to be bedridden after, and we talk about this a bit in our video about what to expect when you get home from your surgery, but you may need some help for some time, depending on your age and depending on your abilities before your surgery.
Say you are going home, Paul, do you tell them to do anything to their house?
Well, I think...
What about those lifts for the stairs?
I'd like to have one of those.
Those do look
cool.
Those do look good.
If it could bring up my dinner for me. No, generally, the physiotherapist makes sure before you leave the hospital, you can manage in your home. So if you have stairs, they'll teach you how to do stairs before you go home. So there's not a lot of modifications you have to do in your house for a knee replacement. You should be able to sleep in a regular bed, and you should be able to get yourself around pretty good. But you might just need someone around to help you for a while.
Common question I get is, Doc, my bed is on the 2nd floor.
Right. Well, I wouldn't, personally, I don't tell people they have to move their bed to the main floor.
Me either.
I think you'll learn how to do stairs before you go home, and the act of going up and down stairs is great physiotherapy for your knee.
Usually I tell people too, you'll probably come down in the morning, and you may go up at night, so you may not be going up and down the stairs. Some people actually will have a walker on the top floor and the bottom floor, but I think you can avoid it if you feel inclined to bring a bed. You certainly could do that. Some people rent special beds. I don't think that that's mandatory, though.
Not in the majority of cases. So we've covered a lot of stuff to do beforehand. Anything else you can think of that people have to do to prepare themselves before their knee replacement?
I'd say one other thing. I think having a plan for swelling in your leg, I think, is critical. I think swelling in a knee replacement is a big problem and a big limiter to your ability to fully straighten, but primarily bend your knee. So some type of icing. So whether that is a bag of peas, a traditional sack type cooler, or a formal cooling unit that certainly have come a long way technologically and can provide significant benefit in that reduction of swelling.
Absolutely. Yeah, I strongly recommend that my total knee replacement patients get some sort of cooling unit, some sort of formal device that is made to cool your knee after. Generally, it's a pad that goes around your knee, and it's hooked up to a reservoir with a pump, and it circulates ice water. And I want people to get that before surgery so they can bring it with them when they come for surgery, and then we can set it up right there.
And either rent that or buy that, right? Depending on the type of plan.
Exactly. Now, what about things that might happen that could happen before surgery that may require the surgery to be canceled?
So I would say the number one reason procedures get canceled in the last 10 years for me would be some type of medical issue. So they're seen early in the morning, and the anesthetist finds something in some of the investigations that is not quite right and that they feel could be optimized. And because a knee replacement is an elective procedure, it does not have to be done emergently, that it can be delayed if they're better. That's probably the number one reason. But the other one that I worry about is an infection locally. So if I have to cut through tissue that doesn't look good, which is probably the exact reason that we tell people, please don't shave your knee, because shaving has a subtle increase of either you making a cut in the skin or potentially getting an infection.
Yeah, don't shave your knee right before surgery. So, and if this does happen to you, if your surgery does get canceled for some reason, some medical reason, it's very upsetting. Everyone's upset, and you have every right to be upset. But try and remember that the reason that it gets canceled is to make sure that you have the best possible chance for a good outcome without any complications.
Just quickly, Paul, if I have a cold, should I just not show up for my surgery?
Just come. If you have a cold, come to the surgery. The surgeon, you, and the anesthetist will all decide together if the surgery should go on or not go on.
Great. Sounds good. I'm ready.
All right. So good luck. It's normal to be nervous, but hopefully this helps you, now that you know some of the things you have to do before your surgery, helps you calm down before surgery.
If you have further topics that you'd like us to discuss or specific questions about this, feel free to email us at talkingwithdocs@gmail.com.
Thank you for watching, and remember, you are in charge of your own health.
See you next time.